We'll be closing this opening session of Isapuliri with Jenny Logenius. But first I'd like to say goodbye to Mr. Sbarra, who is leaving, or better, he decided to remain. So Jenny is invited here to speak. A background in health and safety, great experience in the health industry.
For the opportunity, and great to be here today. I will talk about something that is closely connected to occupational health and safety, and that is training and education, and it's been mentioned several times here today. But first, I would like to say a few words about ESSITY. ESSITY is a global hygiene and health company. We are very focused on sustainability. To the right here, you can see wheat bales, and we are just now launching products that are made out of wheat straw instead of forest pulp. So it's kind of great that we can reuse something that is actually a waste. I work for the brand TORK. You've probably seen us. We are present almost everywhere, from healthcare facilities to offices to industries. We sell everything from dispensers to toilet paper, hand sanitizers, services, and so on. But today I would like to talk about these trainings, and the starting point for developing these trainings has been healthcare-associated infections and the challenges with that. And as we heard here today already, this is a major issue worldwide. We know that about 4.5 million incidents occur every year. It doesn't matter if it's a developing country or it's a developed country, it's still a huge issue everywhere. And it doesn't only affect the patients, it's always a problem as well for the healthcare workers or the cleaners. But there are measures to combat this. So we know that hand hygiene is something that can help with combating healthcare-associated infections in a great way. If we can only improve hand hygiene, you can reduce the occurrence of healthcare-associated infections by up to 50%. That is how important it is. Another measure is, of course, cleaning and disinfecting environmental surfaces. As you're probably aware, bacteria like C. diff can last a very long time on a surface. If it's spores, it can be there for 5 months. So it's extremely important how you clean, and that the cleaning staff is aware of this. Now I can't really move on. Yeah. So the cleaners and the healthcare staff, they have an important role to play here in minimizing healthcare-associated infections and improve patient safety. And it's also important that the hospital have a complete strategy. You need to have something called a system change, and that means that you need to have the right products and services in place. You need to train and educate. You need to have the right information, procedures, and standards. You need to have the feedback as well, because the staff need to understand, am I improving or not? And all of these together form something called a culture change, a new normative or a behavioral change, and that is super important. We did some investigations and some surveys among cleaning staff and healthcare workers, what they think about the challenges of training. And a lot of them think it's a lack of novelty. You can imagine being a cleaner or a nurse for 30 years and people get to nag about training and how you should handle your hand hygiene or your surface hygiene. It's really boring, right? So they want to be more engaged in it. They also think they want better training. They really don't appreciate the training they have today. We saw that 10% didn't really follow any guidelines, which is a bit worrying in itself. I also had one nurse saying that she didn't believe in training. So yeah, there were a lot of things that can be improved. We can also see that language barriers is something that is a trouble as well when it comes to training. So when we started to develop these trainings, I had to go out there myself. So this is me in the local hospital in Sweden. I had to go with the best cleaner we had. I shadowed her and tried to see what was the challenges that they faced. And it was clear that they need to understand how important they are for patient safety and also for protecting themselves, because it's not good that you just put on a pair of gloves and think that you are safe the whole day or your whole shift. You have to change the gloves, you have to sanitize at the right moment, and you have to clean according to the procedures. We think that we need to create some sort of behavior change. We think it's necessary to have it very visual and also engaging. So this is why we developed the trainings in interactive formats and also in virtual reality. And we have them translated into a lot of languages. And when we started to develop the trainings, we used something called a cone of learning, because this is important how you take in education or training. It is about the level of the involvement. So if you read something, which is quite passive, if you read something, you remember 10%. But if you hear and see something at the same time, you remember more, you remember 50%. If you actually simulate something, or if you do it in real life, you remember as much as 90%. And this is why pilots, when they train to become pilots, they go into simulators. And we are thankful for that, right? So it is about training in a completely safe environment. And we thought the same for cleaning staff and for healthcare professionals such as nurses. They should train in a safe environment and not risk to harm any patients. When we developed this training, it actually took 4 years from idea to final training. We developed it together with behavioral scientists because it was important that the ones taking the training really, really learn. We developed it together with the leading experts within surface hygiene and within hand hygiene, actually the ones developing the guidelines themselves. We also worked closely with university hospitals to make sure that they felt that this was close to their reality. So the first training we developed is the TORK Interactive Clean Hospital Training. We based it on the AHE guidelines. AHE is the Association for Healthcare Environment in the US. And this has been the base for the steps and the tasks that you have in this training. But you can also tailor this training to your own local hospital's guidelines. So that is a possibility. It's easily accessible. You can try it out on your phone or on a computer. And it's also a test. You get tested how well you know the high-touch surfaces in a patient room and how well you clean them. And you get a certification upon completion. And we have it in 27 languages because we realized it has to be in the language that many cleaners speak. So it is in everything from Somali to Arabic to Swedish to Spanish and English. A lot of languages was necessary. And then we have another training, which is the TORK Clean Hands training. And this one is in virtual reality, but also in desktop version. And here you sort of step into a virtual hospital. You take care of 3 patients, and you do things that you do normally every day. You care for a wound, or you give medication. And you can choose to either be a physician or a nurse. And you have to remember when to sanitize your hands, when to put on gloves, and you have to do it in the right order. And the good thing with these tools is that you can stop them if they are doing something wrong. You get a sign. Now you have to do this right, and you can't really continue in the training unless you're doing it right. And we are so proud. We have got awards for this training. We had the ISSA Innovation Award last year for this training, and we also had the Interclean Award 2019. And it's also, since a couple of weeks back, a GBAC star registered program as well. So all in all, this is interactive and engaging content that we now see works really, really well with the people taking the training. They get feedback and reinforcement while they're training, and they think it's so fun. You can actually see when they're putting on the headset and they almost try to run away with the headset on because they are so engaged. They get alarms like you normally do when you're at work as a nurse. And the cleaners, they get the strategies that you need to have in place when doing cleaning. And it's easily accessible, so we try to launch it in as many ways of training as possible. So it's available on desktop, but the virtual reality you can find in App Store, in Google Play, in Oculus for free. So we want as many hospitals and as many of the cleaning staff as possible that take the training, so they avoid making any mistakes. So this was all from me. Thank you so much.
Well,